Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. I'm here with your lower back pain and commuting tip. One of the hardest things for lower backs is a long commute. Driving puts your back in a difficult position for your discs. If you have a long commute, the first thing to do is try to adjust your seat to make it more comfortable. If you can lean your chair back, that'll probably feel better as discs prefer not to be too flexed forward. If you have a lumbar support, then use it. If not, try a small pillow or a rolled up sweatshirt. That works too. Next, stretch for a few minutes before getting in the car in the morning. The looser you are before you get in and start driving, the better. When you're in the car, get as comfortable as possible, but then also try and fidget throughout your drive. Yes, fidget. Change positions a bit as you drive. Spines hate static positions for too long, so move around and get the juices flowing. Finally, take breaks on your commute. Ideally, you'd stop every 20 minutes. If this isn't realistic, and sometimes it's not, try and stop at least every 30 minutes, even if it's just to stand up, stretch, and get right back in your car. If your back hurts, making sure to do these things are doubly important as part of your treatment. If your back doesn't hurt, then still try and follow these guidelines as part of good back hygiene and as a way to help avoid spinal issues in the future. An ounce of prevention really does beat a pound of cure. One final point is that a higher seat is going to be easier on you than a bucket seat. So for example, an SUV is usually a lot more comfortable for your back than, say, a Maserati. I had a patient who retired from his hedge fund a while ago, and he bought a super expensive vintage Porsche and absolutely loved the car. But every time he would get in it and drive it for a while, his back would go out. He'd come in, he'd see me, I'd fix him up, I'd get him his exercises, and he'd be good until the next long drive. Finally, he decided the car wasn't worth it, and he switched over to a sedan of some sort, and he was fine after that. I did suggest he donate his Porsche to his doctor, which obviously seemed reasonable, but he laughed as if I were joking, so I'm not sure what he did with the car. For more back pain and commuting and other tips, as well as in-depth information on all things orthopedic and musculoskeletal, click like here, subscribe, and tell your friends to do the same. Thank you.